Evaluation and Management, E.M. Services Guidelines, E.M. Guidelines Overview. The E.M. Guidelines have sections that are common to all E.M. categories and sections that are category-specific. Most of the categories and many of the subcategories of service have special guidelines or instructions unique to that category or subcategory. These guidelines are to be used by the reporting physician or other qualified healthcare professional to select the appropriate level of service. These guidelines do not establish documentation requirements or standards of care. The main purpose of documentation is to support care of the patient by current and future healthcare teams. These guidelines are for services that require a face-to-face encounter with the patient and/or family, caregiver. For 99,211 and 99,281, the face-to-face services may be performed by clinical staff. In the Evaluation and Management section, 99202, 99499, there are many code categories. Each category may have specific guidelines, or the codes may include specific details. These E.M. guidelines are written for the following categories: office or other outpatient services, hospital inpatient and observation care services, consultations, emergency department services, nursing facility services, home or residence services, prolonged service with or without direct patient contact on the date of an evaluation and management service. Classification of Evaluation and Management, E.M. services. The E.M. section is divided into broad categories, such as office visits, hospital inpatient or observation care visits, and consultations. Most of the categories are further divided into 2 or more subcategories of E.M. services. The basic format of codes with levels of E.M. services based on medical decision-making (MDM) or time is the same. First, a unique code number is listed. Second, the place and/or type of service is specified, e.g., office or other outpatient visit. Third, the content of the service is defined. Fourth, time is specified. A detailed discussion of time is provided in the guidelines for selecting level of service based on time. New and established patients. New patients. A new patient is one who has not received any professional services from the physician or other qualified healthcare professional or another physician or other qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice, within the past 3 years. Established patients. An established patient is one who has received professional services from the physician or other qualified healthcare professional or another physician or other qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice, within the past 3 years. See decision tree for new versus established patients. Initial and subsequent services. Initial services. An initial service is when the patient has not received any professional services from the physician or other qualified health care professional or another physician or other qualified health care professional of the exact same specialty and subspecialty who belongs to the same group practice, during the inpatient, observation, or nursing facility admission and stay. Subsequent services. A subsequent service is when the patient has received professional services from the physician or other qualified healthcare professional or another physician or other qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice, during the admission and stay. Services reported separately. The physician or other qualified healthcare professional may need to indicate that on the day a procedure or service identified by a captain code was performed, the patient's condition required a significant separately identifiable E.M. service. This circumstance may be reported by adding modifier 25 to the appropriate level of E.M. service. History and/or examination. E.M. codes that have levels of services include a medically appropriate history and/or physical examination, when performed. The nature and extent of the history and/or physical examination are determined by the treating physician or other qualified healthcare professional reporting the service. The care team may collect information, and the patient or caregiver may supply information directly, e.g., by electronic health record (EHR) portal or questionnaire that is reviewed by the reporting physician or other qualified health care professional. The extent of history and physical examination is not an element in selection of the level of these E.M. service codes. Levels of E.M. services. Select the appropriate level of E.M. services based on the following: 1. The level of the MDM as defined for each service, or 2. The total time for E.M. services performed on the date of the encounter. Within each category or subcategory of E.M. service based on MDM or time, there are 3 to 5 levels of E.M. services available for reporting purposes. Levels of E/M services are not interchangeable among the different categories or subcategories of service. Thank you.